casualties of the failed health care reform debate of recent months centers on children's health and community health centers. Congress missed a September 30th deadline to reauthorize funding for the CHIP, Children's Health Insurance Program, and community health centers across America. I sat down with LaShannon Spencer, CEO of the Community Health Centers of Arkansas, to learn more about her organization and how it could be impacted. I'm with LaShannon Spencer. She's the CEO of the Community Health Centers of Arkansas. Thank you for being here.
Thank you for allowing me to be on your show.
All right. Let's talk a little bit about what community health centers do, because I think that not everybody knows you by a household name.
Absolutely, but I think people more so in rural Arkansas and rural America really knows what a community health center is. A community health center is a patient-centered organization that provides preventive comprehensive care services that includes medical, dental, vision, and mental health services. And also we have different specialist clinicians like nutritionists, dietitian, to really be able to offer those medical services up under one roof.
How many community health centers are there in the state of Arkansas? And your organization is just an umbrella organization for them,
That's
right?
correct. We have over 100 sites across the state, and some of our sites are actually school-based health clinics as well. Because when you think about the mile radius to a provider, especially when you're looking at a community like a Portland, Arkansas. So there's a school-based health clinic that not only serves children, but also serves adult patient populations as well.
Yeah, tell me how the funding works for these community health centers and how you guys are an integral part of that.
Our funding here in the state is funded by HRSA. So
Wait
it's,
a second, you're throwing an acronym
I'm
at
sorry,
me. HRSA.
it's Health Services Resource Administration. That's up under CMS. But we're funded on a federal level. And in some states, they have matching Medicaid dollars as well. Mm-hmm. So all of our funding here for community health centers come from the feds, and it's taxpayers' money. But what I want to really emphasize is community health centers offer a cost savings to the state of Arkansas when it comes to Medicaid beneficiaries. They are truly that one-stop shop to be able to offer comprehensive care before that patient or that beneficiary actually goes seek medical attention within the emergency room.
Well, let's talk about funding at the federal level. Obviously, it's been a nightmare for the last
It has. And when I tell
months.
people that I can't sleep, because I believe that everyone should be able to have access to quality healthcare services. Right now, there's a potential funding cliff, and that deadline is closely approaching, that our federal delegation has the opportunity to make that decision to prevent that cliff. It's on September 30th. But if that funding cliff does happen and that extension is not granted, we could see some closures of community health centers, not only in Arkansas, but across the United States. So if we have closure, that affects economics within a community. That's job losses. That's a lack of access to healthcare services right there within a community.
Should there be a different option for funding? You guys exploring what, not necessarily just because of what happens there, but just longer term?
Yeah, but it makes you think as that leader how we need to truly diversify our funding stream and do more of a public-private type of partnership and work with different foundations to help offset grant dollar funding.
All right. Community Health Centers of Arkansas. Mm-hmm. 100 I didn't realize
over 100 sites.
Amazing
yes.
to me, so.
Just here in Pulaski County, we have our care and we have Jefferson Comprehensive Clinic. So they're in places that you would never know, but it's incumbent upon me to make sure everyone knows what a community health center is.
LaShannon Spencer, thank you so much for being here. Good to see you.
Thank you, Roby, for having me. Thank you.
All right. And on this Sunday's Talk Business and Politics, Senator Tom Cotton will address CHIP and Community Health Center funding. Be sure to tune in on Sunday morning. That's all for this edition of Talk Business and Politics Daily. Thanks for tuning in.